So as I look at the next 5 years of healthcare IT, we're going to face many challenges. 2011 is all about getting doctors to use electronic health records and, of course, storing their records securely. But 2013 and 15 are going to be more about exchanging data and really having communities of data sharing. And so as I've looked to my particular needs, I've built cloud computing facilities. These are really private clouds for now, and that is that I have terabytes and terabytes of healthcare data that I need to exchange across the community based on policies. I need to do it with great reliability, and I need to do it at low cost. And so we have been able to, in both my community data center and in my primary data center, achieve a sense of cloud storage that supports all the meaningful use activities, not only today, but to 13 and to 15. Now we've also got healthcare reform coming. Healthcare reform is going to be much about not just process of care, but outcomes. And by outcomes, I mean the wellness of the patient. We're not going to see reimbursement for redundancy. Now here's a challenge. Especially in the world of radiology, one man's redundancy is another man's BMW. There's going to be a disincentive built into our system today to share radiology images. Tomorrow, that will go away. In fact, Medicare and Medicaid probably won't reimburse for redundant radiology images. So again, this implies a cloud of image management that I can share across the community based on policies. What we've done at Beth Israel Deaconess is really had an enterprise image management view. We have ologies, cardiology, radiology, pulmonology, the list goes on and on. Many PACS systems, many departmental systems. They are no longer scalable, reliable, and secure enough. Our vision is move them all to a private cloud. And why? Because we want one-stop shopping across the community with patient consent and, of course, appropriate security controls to view any image from any modality in one way. And the only way we can really do that is by having a policy-based archive that is able to take data from multiple modalities, put it into a single archive where we can do life cycle management at low cost and distribution of images through a single viewer. And we've done that for cardiology across echo and cath and multiple modalities. We're moving into radiology, and as new mini PACS sources are put into our departments, fine. Local cache may be run by a department, but long-term archiving, that's all done centrally via our cloud. The technology is working. We've really seen that the various risk PACS vendors, the folks making modalities, they're seeing this cloud strategy is going to work. So we've had a close partnership with many vendors, storage vendors, as well as modality and middleware vendors to make the cloud solution work. So whether it's electronic health records for healthcare reform, whether it's image management across all the ologies, the cloud strategy works. Private clouds for now, but who knows, in the future, even public clouds, global clouds for reliability and security that are run by trusted vendors may very well be cost-effective and good enough. So cloud is not just a buzzword, it's truly a reality in support of meaningful use and healthcare reform.
Currently, we're using the Atmos cloud storage, private cloud storage platform to support the cardiology organization in their medical PACS archive. We have some longer-term plans for other ologies to be put into the cloud. We saw this as kind of the future of where archive storage was going in terms of being able to use a policy to dictate how many copies, where, when, what, and how long to keep the data long-term. So we see Atmos as the future of where medical archive is going to go.
Atmos had that archive that we needed at a cost that we could afford with the policies that we needed to control data flows. It also had the technology necessary to interface to these multiple vendor products, whether those are modalities generating images or middleware products that serve as archives in the middle. Atmos has proven to be reliable, interfaceable, it has met our goals, and so our feeling is that as a private cloud at low cost with the characteristics needed especially to support radiology, Atmos has been a winner.